Although the prices are going up for consumers and employers, health disparities continue to be an issue. Those with lower incomes are significantly less likely to have a usual source of care compared to those with higher incomes, according to a Morgan Health report. To break it all down for us, we have Dan Mendelson, Morgan Health CEO, and Yahoo Finance's very own Anjalee Khemlani. Dan, good to talk to you today. Why is it that these disparities still exist?
Look, I think it's really important for employers to understand that these disparities are really endemic in healthcare. And there are a lot of reasons why the disparities are there. It's really about the healthcare system. It's about availability of resources, primary care resources and tertiary care resources. And it's about affordability. And if employers can come together to really focus on these areas, we can make some progress.
Dan, good to see you again. Anjalee here. I want to dive into this affordability concept because I think it's important to note that the affordability part of the equation is both an employer problem and an employee problem. We've seen premiums rise over the year, 7%, as we mentioned, this year alone. But it has been something that employers have been focused on for some time. I know a Kaiser Family Foundation survey recently saw in the past 2 years that employers are focused on this, and 87% of those respondents did say that they anticipate that the growth of premiums is going to be unsustainable and the cost of healthcare is going to be unsustainable in the next decade, up to a decade. So I want to dig into that and sort of how that plays a role in these, in these disparities, because I think it's something to be talked about when it comes to how we're funding healthcare in this country. No?
Costs are going up, and that's a major issue for small businesses as well as larger businesses. I mean, that's an indisputable fact. I think that the issue, though, is bigger than that because we see disparities irrespective of whether, an employee is well covered or not. And so these disparities go back to the way that healthcare is being delivered and in the nature of how people are being treated in the healthcare system. So what's really important is that employers understand the disparities and that they're not just about the rise in spending and that they hold their providers and insurance companies accountable for making improvements in those areas.
How can that happen, though? Because as far as I've ever heard, and correct me if I'm wrong, employers are sort of seen by the insurance industry as moneymakers, right? They have employees that they need to entice and take care of, and therefore they sort of maybe bloat up, the benefits, and the plan design is based on that need, rather than some of the other metrics that are used, say, in the exchange and other areas like with the government, when the idea is more of an efficiency play. And so we've seen, because employers are about half of the insurance industry's revenue in the country, I just wonder how they can be, taken advantage of less. Like, what do employers need to do to start bringing this conversation back in their favor?
That's a great question, and that's really the focus of Morgan Health and what we're all about. I'd say that look, employers pay for about half of the healthcare in this country. About 180 million people are getting their insurance through their employer, and it's really, large corporations like JP Morgan Chase spends about $2 billion a year on healthcare for workers. And what that means is that we can have conversations with our insurers and we can drive expectations and we can make the expectation clear that we as a payer really expect to be paying on the basis of value, and that we consider health equity to be a very core component of the value that we are receiving. So we want to make sure that all of our employees, all cohorts of our employees, are being treated well, and those are the discussions that we're having. And then part of it also is in education. I mean, look, one of the findings from our study, which is really important, is about C-sections for low-risk pregnancies. And what we see in the study is that employees nationally who are Black will have higher rates of C-sections for uncomplicated deliveries than white employees. That's wrong. And we have to get on top of that. We have to understand the mechanisms of that. And as employers, we have an opportunity and an obligation to make sure that the insurers who are working with us are on top of this.
Absolutely. I know on the other side of that equation, there's a lot of focus on maternal mortality in this part of it. So there's a whole discussion there for sure. Meanwhile, another finding was that sub $50,000 income employees are also less inclined towards having a stable place of care, usually ending up in the emergency room or urgent care. I think that's something the industry has been contending with for years, and telehealth sort of helped that. But we are in a different environment with more of a retail health push. Are there ways that, say, the Walmarts of the world, the Minute Clinics of the world, the Amazons of the world with One Medical can reach these populations in a way that's more cost efficient, even for an employer?
Yeah, absolutely. I mean, one of the things that we're doing right now in our environment with our portfolio company, Apree Health, is that we're bringing primary care into the workplace. So, there's this idea of a clinic in a workplace, and typically that's really been about getting vaccinations and getting, a Band-Aid if you cut your finger. And what we've done is brought in a really outstanding primary care clinic into the workplace. And what this means is that our employees, as they're walking in, will walk past that clinic and they'll be able to avail themselves of those opportunities. And that's the kind of thing that really reduces the barriers to care, and we believe can improve health equity in addition to outcomes.
Dan Mendelson, Morgan Health CEO, and our very own Anjalee Khemlani joining in on the conversation. Thanks so much today.